way to Europe?
Well, the reason why, Peyton Manning had to fly all the way to Switzerland to have the stem cells for his neck, because he wanted to perform at his best. Most athletes, football, but by the time you're 30, you're done, right? And that's because as you age, your stem cell count really takes a dive. That's why after 30, most athletes have to retire. But he wanted to continue to play, and, that's why he was willing to go there. The Swiss and the Germans have perfected stem cell therapy. They're way ahead of us. They've been doing it for over 80 years. And that's how he got the results, came back, won at the Super Bowl at age 39. Even Jack Nicklaus, after a failed back surgery, couldn't golf, couldn't play tennis, stand up at a cocktail party, flew to Munich, Germany, had stem cells from Dr. Alt, who I was scheduled to lecture with him at a stem cell conference in Miami.
Oh.
So he's kind of part of our stem cell association. And he came back from Munich, now he can golf again. So the reason why they go there, A, they can afford it. They probably have their private jets. And B, it was banned in the U.S., right, when they had it. But finally, we have the 21st Century Cures Act and the Right to Try bill, where you have the right to try it in the U.S. now. So, yeah.
That seems crazy that we wouldn't have the right to try something in the first place.
Well, it's because, we know that, Big Pharma has a big, monopoly in healthcare in the U.S., and, they have big lobbyists to kind of lobby FDA and Congress to kind of suppress this natural therapy, which is basically, I think, is a solution to the opioid epidemic and the pain crisis. But, let's face it, Big Pharma's not after your health, it's their wealth, right? But look at this opioid epidemic that they've created. It's out of control. Yeah.
And what are other doctors saying about this that are seeing, because I'm sure these patients have other doctors that they go to, knee specialists and back specialists, and how are they reacting to what's going on with the stem cells?
Well, if you look at academia, like top medical institutions or research institutes, a lot of these researchers, they're going to say, "Oh, show me the clinical trials, show me the evidence," and they're doing a lot of trials in stem cells too. But a lot of these trials are funded by these big pharmaceutical companies. And everyone says, "Oh, show me the clinical evidence, like this treatment or drug works." Okay, now let's be frank. Most of these clinical trials for these drugs to get them approved through the FDA, takes many years of clinical studies. Multi-million dollars. And a lot of the data is fudged. A lot of the clinical trials is fudged, so they get positive outcomes, so they can push these drugs through. So just because the FDA approves them doesn't mean they're safe. Like Vioxx, they took that off the market, right?
Yeah.
And I'm sorry, but a lot of these stem cell labs, they don't have these multi-billion dollars or 20 years to do these studies. Well, guess what? A lot of patients, they can't wait 20 years to get out of pain. They want their lives back.
Right.
So, we're offering something natural, that doesn't have all these side effects like these drugs, risky surgeries, or injections.
You were just answering my question. My next question. What kind of, is there any risk to somebody trying this?
The only real risk, because it's a biologic, it's just a cell, right, is you can get an infection. But our orthopedic surgeon who actually does the injection, he's going to disinfect the area with betadine and alcohol. And, out of the hundreds of procedures, we haven't had one serious adverse event, no infections or anything. I mean, it's good clinical practices that we follow. Yeah.
That's great.
Yeah.
Well, listen, we have to take a break, but you're listening to Living Pain Free with best-selling author and pain specialist, Dr. Philip